the merciful, the compassionate. First of all, I would like to thank the organizers of this Congress for, invite, for inviting me to talk about laboratory diagnosis of Leishmaniasis and why it is important. As you know, Leishmaniasis is the group of disease caused by an intracellular protozoan parasite transmitted by the bit of the female phlebotomin sample. Infections in humans are caused by more than 20 species of Leishmania. Today, more than 1 million people live in area endemic for Leishmaniasis and are at risk of infection. And it's estimated 3,000 new cases of visceral Leishmania and more than 1 million new cases of new cases of Tetanus Leishmania occur annually. We have four different forms of Leishmania: Tetanus Leishmania, mucotetanus Leishmania, visceral Leishmania, post-Najaf Derma Leishmania. Based on the report of World Health Organization, is distribution of endemicity of Tetanus Leishmaniasis worldwide. And another, you can see another map, status of endemicity of visceral Leishmania worldwide. Why is laboratory diagnosis of Leishmania important? With correct early diagnosis, patient can be treated faster and the treatment period can be shortened. It prevents the creation of scar, the spark of scars. The type and length of treatment can be decided by laboratory diagnosis of the type of disease, zoonotic Tetanus Leishmania or anthroponetic Tetanus Leishmania. By the early diagnosis can suitable treatment, secondary infections, and accurate diagnosis, chronicity, and identify the type of tetanus causative agent in ACL, which human are the reservoir of this disease can prevent the spread of the disease. In the endemic center is maybe prevent to control measure and diagnosis help the patient is reduce treatment cost, proper diagnosis and treatment of patient prevent the development of drug resistance. The ability to detect parasites such as the number of amastygot present in aspirate and scarpings or biopsy specimen, the level of the host immune response, the absence or presence of bacteria and fungal superinfection, whether the specimen is collected form an active or healing lesion. If the patient has multiple lesions, a specimen should be collected from the more recent and active lesion. Diagnosis Tetanus Leishmaniasis is based on the both clinical and paraclinical. clinical history is very important. Resistance in our history of travel to endemic area, painless lesion, clinical course, similar case in other family member, physical examination is such as induration and exposed site. Another paraclinical, such as one parasitological method, immunodiagnosis, molecular methods, and non-specific procedure. For diagnosis, we are looking for tests that meet at least 18% of these conditions: specific, sensitive, reproducible, rapid and cost-effective, safe, and easy to perform in the field. Diagnosis method of tetanus leishmaniasis is parasitology method, immunodiagnosis such as Leishmania skin test or LST, molecular methods, and serology. Parasitological method including direct smear culture, medium 3N, and injection into susceptible laboratory animals, hamster, biopsy, and Suri mouse. Direct smear is important, gold standard in diagnosis Leishmania. There are three criteria for laboratory diagnosis: one, optimal sampling; two, optimal staining, Giemsa stain; three, accuracy and patience in looking for the parasite. If these three criteria are met, up to 80% of the case will be diagnosed, and we will not need other methods. Definitive diagnosis depend on demonstrating of amastigot in tissue specimen or the paramastigot in the culture. Another method, parasitological in culture in 3N medium, RPMI, and Schneider. You can see paramastigot stage in culture medium, and another parasitology method, injection into susceptible laboratory animal, Suri mouse and biopsy mouse. Another diagnosis of tetanus leishmaniasis is immunodiagnosis. Leishmania skin test or Montenegro skin test. Daily hypersensitivity test, 0.1 ml of Leishmania antigen is injected intradermally into the forearm area, and after 48 to 72 hours in the duration is measured with a roller, which is considered positive if it is above 5 millimeters. This test is used in epidemiological investigations and is not usually used for diagnosis of tetanus leishmania. In mucotetanus leishmania, this test has a diagnostic value of more than 72%. In visceral leishmania, since the test remains positive after the treatment and recovery, it is not useful for diagnosis. Another immunodiagnosis, ELISA test, immunofluorescence test, IFR, and strep test. Molecular diagnosis or polymerase change reaction or PCR is good need is good sampling collection, DNA extraction, and primary design. Application of molecular methods in Leishmaniasis, determination of origin and genotype of the disease agent, determining the disease in atypical and low parasite forms of Leishmania, determination of Leishmania resistance to anti-Leishmania drugs, epidemiologic study of the disease, and parasite load estimation, real-time PCR. All of them invite to International Congress Dermatology, Cosmetic and Laser, 4 to October 2023, Tehran, Iran. Thank you.